Welcome to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. We reveal the science-backed strategies that truly work in a sea of fads. We explore the physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who've conquered life's health challenges. Are you ready to unlock your potential to live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome, everybody. You are watching the Health Revolution. I'm your host, Adriana Morrison, and we are thrilled that you are joining us today. No matter which way you're tuning in to us, please do not forget to hit the subscribe button. We want to stay connected to you. Also, at the bottom of your screen, there is a tab for show episode notes. There's some important information about today's episode you don't want to miss out on, so be on the lookout for that. Today's episode is exciting because we're talking about the things that really light us up in the space of living our best life. We talk anti-aging, we talk about the regenerative space, where we are doing all things to amplify and to maximize our life, the vitality, all of that we embrace. So how do we approach this? What are some best practices and what are some things when it comes to that holistic well-being that we can embrace that maybe we don't know about? And today we are speaking to an expert who is all about that. First, take a look at this. Meet Dr. Jordana Quinn, a pioneering leader in holistic health and wellness who combines expertise in regenerative medicine, anti-aging medicine, and psychedelic medicine. As a board-certified physician, Dr. Quinn champions the philosophy that each individual harbors an intrinsic ability to heal and transform. Her practice goes beyond conventional medicine, focusing on the critical mind-body connection. Dr. Quinn's innovative approach tailors treatment plans to harmonize the mind, body, and spirit, offering a comprehensive path to well-being. Her dedication extends beyond her medical practice to wellness retreats, where she nurtures this philosophy of holistic healing. Today, we will explore how Dr. Quinn empowers others to awaken their natural healing potential, achieve true harmony, and experience transformative health through the profound connection between mind and body. Dr. Jordana Quinn, welcome to the show. How are you?
I'm great. Thank you. Thank you for having me. How are you?
I'm doing fantastic. I can't wait to dive into it. So your journey into holistic health and wellness, how did it come about? And at what point in time in society did it become ever apparent to start looking at this from a holistic approach?
Yeah, I'm going to try to be brief because it's kind of a long story, but essentially I've always been more holistically medicine minded. I have been an athlete my entire life. I was a gymnast and then a competitive diver in college, and now still I'm very athletic. And so I think when you're an athlete, in part, it gives you a sense of the human body performance and how exercise plays a role in your health, and also how what you put into your body via diet plays a role in your health. So that was my background. And when I went into medical school, during the medical school process, we always have to present, or we did in our class, on each of the systems. So when we would present on the cardiovascular system, I always gave the holistic approach to cardiovascular health. And when we presented on the endocrinology system, I gave the holistic approach to endocrinology. And so it's always been innate with me. And additionally, growing up, my mother made us eat really healthy. Like, she wouldn't buy us any food that had sugar. And she was already kind of in that functional medicine realm where we ate all natural foods. We had a garden, and that sort of thing. So that kind of made up who I was. And so, my residency training, I'm board certified in physical medicine and rehab, which is anything that makes you not move normally. So, from head injury to spinal cord injuries, sports injuries, neurologic conditions, I mean, anything that makes you not move normally is what I'm board certified in. And I went into that to specialize in the musculoskeletal or sports medicine component. So, very well trained in pain management, sports medicine, that sort of thing. And so, my initial job that I had outside of residency was pain management, where I was begging people essentially to take care of their health. And and it just didn't align with my value system. And I saw some sports medicine patients, and if I could very briefly, and this isn't always true, but what I found the difference to be between a sports medicine patient and a chronic pain patient, just as the title goes, is they often had the same ailments. And this isn't true for everyone, but chronic pain patients as a whole tended to seek out a pill that would help fix them and have an excuse for their pain. And sports medicine patients with similar injuries or disease states would come to me saying, what can I do to feel better, and want to do the physical therapy on their own and put in the work in on their own. So anyhow, during my first couple years in practice, I really found that I was reading like nutrition books for fun on the side, literally in my free time, and begging people to take care of themselves during the day. And when I had some high level athletes that like couldn't do steroid injections, for example, for their shoulder pain because that's they're not allowed to take any sort of steroids prior to competition. I was looking things up like platelet rich plasma injections and stem cell injections and things that would help them. And kind of long story short is I found a clinic near me that would do it. And so I was sending patients there. And over time, there was one chronic pain patient that had a really terrible disease. And she wanted an alternative approach. She didn't want to take all of these opiates and medicines that really suppressed your brain function. And so I found a clinic that did IV magnesium infusions that would help like pain. And it would happen to be the same clinic that I had sent people to for the stem cells and things. And so I look into this clinic and I was like, what are they doing? It sounds amazing. They should hire me. And long story short, they hired me. And the physician hired me to do the regenerative medicine stuff because I'm trained in those sorts of injections. And he was an anti-aging medicine doc. And it blew open my world of what is possible in the realm of medicine. And so it was really focusing on taking a functional medicine approach, focusing on what you put into your body from a stress standpoint, from a diet standpoint, from a lifestyle standpoint, you know, what we think about, what we listen to, and in our community. And so that's how I ended up in this space of, you know, anti-aging medicine and stem cells and things. And just circling back and talking about the difference in my, you know, very brief, the difference between a chronic pain patient and a sports medicine patient is that mindset, right? And when you realize the mindset going into medicine of you need to change me, I want a pill to fix me, I need a surgery to fix me, versus what can I do to fix myself, that made all of the difference in patients' outcomes. And so over time in the anti-aging space, I discovered psychedelics and realized the power of this medicine in terms of really healing. If you heal the mind, you can heal the physical.
And you know, there is so much I want to unpack with this. I'm so glad you brought all this up. I want to start with I love that you brought up the distinction between a chronic pain patient and an athlete who maybe had a sports injury, and in terms of, you know, the being sidelined, the difference maker being mindset. How common or uncommon is the distinction between the two in the general society space? Is the approach to an athlete who's healing, are there things that perhaps we should be tapping into more that the chronic patient is not exposed to because of how things have been handled? What's your take on that?
That's a really good question. I think so. I mean, I'm just trying to say it in. There's two parts of this answer. I was trying to explain it how just kind of I saw the world. So that's not. I would not say this is like common knowledge in medicine where people are like, "You're coming to sports medicine, you probably want to get better, but if you show up to pain management, you don't want to get better." That was just because I worked in both realms. Kind of my stereotype that I came up with. However, I do think that in addressing what you said, when someone shows up to a rehab doc or an orthopedic surgeon, I mean, they do see a lot of high performers who are looking to get better and probably have a bias already before the patient walks in the door about how to treat that patient versus when you are sent to a pain management clinic. They also probably have a very different bias because they're seeing different people, right? I mean, as humans, we're already biased. So I would say a pain management doc and maybe an acute or a sports medicine doc initially have a bias going into it. So they probably are being handled differently, even though we're trained similarly, unfortunately.
I
So I
think
don't know.
I think you bring up a good point about that there's trends in society, and the way I took your input is that there's trends that you've noticed between the two, and I'm wondering if the for many people who might fit in the category of like I'm in chronic pain, if they feel disempowered and
Yes.
not been they've not been exposed to elevating their selves in terms of
Yeah. I
you
mean,
know
I think this is could go very levels deep, right? Because when I worked in the pain management clinic, I felt like I spent the entire visit with my patients begging them to take care of themselves. Like, oh, you could go whatever. I mean, you could go to physical therapy or you could do these little things at home or you could, maybe not eat Doritos for every meal. But and like most of them didn't care. I mean, right? And versus if an athlete comes in, they care, like they recognize all of those things are important. And so but it's also like what came first, the chicken or the egg? Have they been in this system that hasn't cared for so long that they just came to me like, I want a pill or I want an injection? Like when did that start? Or was that part of their, and I'm sure it's multifactorial, or was that part of their upbringing where they were never empowered to be able to make choices in their health, or they weren't given sports as a young person or even the option to? I mean, it's probably all of those things. I don't think it's just one or the other.
it reminds me of a during 2020, I was in a serious car accident, and so I had to have physical therapy. And then, as I remember going through it, the staff was wowed, so to speak, by the fact that I had perfect attendance, and then had shown up. And I think that, and they made a comment towards the end, like you were model patient. And when I asked them, is this something that you see? Is this surprising? Is this your expectations? And they say, well, these days it's not as the perfect attendance, the eagerness to, that it's not the more common scenario for them to say that. And so I remember for me, I couldn't wait to get better. I felt disempowered by being in a neck brace and all of the things. And so, and I'm just wondering if it's like self-limiting beliefs that maybe they're dealing with before the clinician is, and the specialist is dealing with the with, say, said patient with their
Yes.
condition that they're going through.
I mean, I think it's all of it because I do think it's someone's just, I mean, innate, whether it's socialization, right? Nature, nurture, growing up, like we can guess. But let's say innate as an adult, wherever that innate comes from, motivation to want to get better. I think we live very much in a culture and in a time where everything happens so fast. So part of it is you expect results tomorrow, and that just doesn't happen. Your physiology takes time, healing takes time, and there is just a real time that no matter what you do, that things are going to take to heal in of itself. You can't rush physiology. However, you can help by doing things like physical therapy or strengthening yourself or eating well so that at baseline your immune system is boosted and so that you respond better to injury or to disease. And we live very much in a culture, unfortunately, of blame. And not taking responsibility for our actions as a whole. And so therefore, I believe, again, this is my personal belief, that we also want to blame our genetics on our state of health, or we want to blame our circumstance on our state of health. And we don't really realize how much control of our health we actually have, no matter what our genetics are, or no matter what our circumstances are. And all of it is impactful in our health. Our childhood traumas and our childhood experiences for sure affect and directly affect our health no matter what we do, but it's not the end all be all. Our genetics for sure affect our health and our disease, but it's not the end all be all. Just because your parents had heart disease doesn't mean you will. And we know this now in the genetics and something that's called epigenetics realm, that you might be given a set of genes when you were born, but based on your lifestyle, you have the ability to turn those genes on or off. And so we know that your lifestyle very much impacts your genetics, as does your mindset, and your limiting beliefs actually affect your genetics. And so it's so fascinating and so beautiful, I think, to be able to help people in this way, because I love what I do. And I love being able to really help people see the power of healing within themselves and believe it. And so many people come to me with, I have this problem, or I have this disease, or and they get caught up in the title of their disease. And it's such an interesting mindset of like, I am dysfunctional, as opposed to dysfunction is a part of me, right? And that's very different.
Can you describe for our viewers what is regenerative medicine?
Yes. So regenerative medicine as a whole is the ability for your body to renew and regenerate. And there's many things that can help your body do that. And so there's many practitioners that will put themselves in this huge globe of regenerative medicine. But when I talk about regenerative medicine, and for the sake of this show, I'm talking about the branch of regenerative medicine that is using your body's own cells to heal itself. So we're talking about things like platelet-rich plasma, where we take your blood, get the platelets out and inject them back in, or take your stem cells, process them, and inject them back in. And you can use those two things for many different purposes, mostly because of my training and background. I do it for sports injuries or chronic pain or pain in the body. But people are doing regenerative medicine. We do it some for aesthetics or for hair growth, because when you're actually using the body's innate healing, it really can impact so many things. You're not just treating the symptom, you're treating the dysfunction.
And how new is regenerative medicine? How far back does it go?
So I've been doing it for 13 years, and I will say that it probably goes back 15 to 17 years. So I was a very early adopter of regenerative medicine because of my, being more holistically medicine minded. I think our creator did something right when they created us, and if we can harness that ability, that innate healing ability. So it just made sense to me, as opposed to introducing outside substances when we don't need to. So I've been doing it for 13 years. I really think, it has become more and more popular since I've been doing it. But I really think in the last couple of years, where a lot of famous podcasters have started talking about it, it's become more popular. It's still not mainstream because it's not covered by insurance. So insurance doesn't cover a lot of the things that we're going to talk about today. So that's sad.
And is there a place do you envision the integration between Western medicine, or what we've known medicine to evolve into, and then the introduction of regenerative medicine? What does that begin to look like as we begin to marry them both, or get the best of both worlds, so to speak?
So I think that, this is what I do in my practice, right? People come to my practice because I'm Western medicine trained. So they trust me as a physician, because I have that education, but they want an alternative approach to care, because they're disheartened with the Western medical approach of just like a 7-minute visit and a pill to fix me or whatever, right? So, and then maybe they don't want to see a complete non-physician alternative medicine provider, excuse me. So, so that's kind of the beauty of how I practice medicine, is they get a little bit of both worlds, or a lot of both worlds. So you can incorporate the two. Unfortunately, I think it's pretty impossible to do under the insurance model. And this would be a whole full 40-hour work week discussion if we wanted to get into the insurance side of things and why they don't cover it. I think it's a tragedy, but I think, the way to incorporate it fully would be the insurance model has to want people to get better.
Wow. We've got a lot that we're going to continue to cover. First, we're going to take a commercial break. Stay put. We're coming back. Don't go anywhere. We will be right back after this. Hi, I'm Adriana, and welcome back to Fit Bites. Today, let's focus on keeping your cholesterol in check, a vital part of maintaining heart health, especially as we get older. Start by being mindful of what you eat. Swap out saturated fats found in red meat and full-fat dairy with healthier fats like those in avocados, nuts, and olive oil. Now, these healthy fats can help lower bad cholesterol, also known as LDL levels, while boosting the good cholesterol, HDL levels. Incorporate more fiber into your diet. Foods like oats, beans, lentils, and fruits such as apples and pears are great for helping your body reduce cholesterol absorption. Aim for at least 25 to 30 grams of fiber daily. Exercise is your best friend when it comes to cholesterol control. Regular physical activity like brisk walking, cycling, or swimming can help raise your LDL levels and lower LDL levels. Try to get at least 30 minutes of moderate exercise most days of the week. Don't forget to keep an eye on your weight. Losing even a few pounds can have a significant impact on your cholesterol levels. Small, sustainable changes in your diet and activity level can lead to long-term success. Lastly, if you smoke, consider quitting. Smoking lowers your good cholesterol and harms your heart in many ways. Quitting smoking can improve your HDL levels and benefit your overall health. Remember, managing cholesterol is all about making consistent, healthy choices every single day. With a little effort, you can keep your heart and your body strong. Stay tuned for more Fit Bites with Adriana. Welcome back to the Health Revolution. Welcome back, everybody. My guest today, Dr. Jordana Quinn. She is a physician in regenerative, anti-aging, and psychedelic medicine. And we're talking about all things of really embracing holistic health and wellness and truly diving into the deep mind-body connection that can amplify our lives. And so, Dr. Quinn, before the break, I know we were talking about just you diving into regenerative medicine. And I'm curious, can you share with us, I know that the point in which you entered that anti-aging realm was when you joined the practice. And can you talk about what that was like in terms of you being a physician and just expanding what you're able to do with patients, and then just your studies in general? What all can we learn about anti-aging?
I mean, when I entered the practice, for me as a person, because I was hired to do the regenerative medicine stuff in terms of stem cells and PRP, I literally felt like I was at home. Like I had just been in a practice that, I mean, there were so many things wrong with that practice, but I would go home and I was so unhappy in that practice of medicine, begging people to take care of themselves, and just, it was not a good place for the patients or for me as the treating physician. And it was just like literally felt so good to be home in medicine. Like I felt like this is why I went into medicine, to help people make a difference in their lives. And I didn't feel like I was impacting true health and lives when I was in the traditional model, which is terrible in of itself. And so that's what it was to me. And so I wanted to learn everything. I mean, I went to 4 or 5 conferences a year. I mean, it's, as physicians, I think we graduate. I mean, we go through lots and lots of schooling, 12 to 17 years of school. And we really think we know, I mean, everything in medicine by the time we're done in our specialty. And it just opened my eyes to, like, there's so much more out there that made sense to me. But I had to do a ton of education. I mean, I read books in all of my non-free time. And I went to so many conferences. I mean, I spent more time and money on my education than any other physician I know who is still in the like regular model, right? I mean, and I still go to a ton of conferences. And so it really took a lot of education. And it took a lot of personal work and development too, to be like, okay, I can practice medicine in this realm. And it's a way that other doctors will think I'm a quack or not think that what I do is legit. And that was a lot of personal work to really struggle with, like, but this is what's best for patients, but this is going to be how other professionals in my as physicians perceive me. And that was actually really a lot of growth for me, honestly. But in the end, to me, it's what's right for the patient, and not about what other people think about me. And so yeah, I mean, I call it a little bit of common sense medicine. I mean, there's a ton of education behind this common sense, but also, this is what you talk about on your whole show. But I mean, the value of compounding interest in health, of eating right and exercising and your mental health and your mindset. I mean, all of it makes a difference. And I always call it the compounding. It's like compounding interest in health, right? The more kind of things you have in each one of those buckets, like your baseline levels of health go up.
And based on your experience, how do you define anti-aging?
So anti-aging, I mean, so there are actual studies in the anti-aging realm. So this is very new medicine. Like in the past, maybe, I mean, I know there's people who've been studying anti-aging for a long time in mice, but there are like people, I mean, David Sinclair is a big person who's written a book on it, and he's a scientist. And so he does research. So anti-aging is really, how can we live a higher quality of life longer? And there are some theories that aging, if we look at aging as a disease, so just as like cardiovascular disease, aging is a disease, we will learn how to combat it, stop it, and actually reverse it. So there are markers of aging. There are biomarkers of aging in your blood. There's telomere length. There's methylation factors. There's many ways that you can measure someone's like biological age versus their actual chronological age, which is like how old are you numbers wise, right? So you could be 50 years old, but your biological age could be 40, or your biological age could be 60. And so there's things that are going to accelerate your age, like smoking cigarettes and stress. And there's things that actually slow down your age, like diet and lifestyle and exercise. And so there's a balance between long-term stress and short-term stress. This is a whole anti-aging conversation. But then there's medications you can take that actually slow those markers of aging. There's supplements you can take that slow those markers of aging. So it's always starting with baseline levels of health in terms of like the functional medicine realm. And then, so it's kind of like functional medicine, but then maybe on like steroids, but not steroids, in terms of taking medications or supplements that might actually slow that process of aging.
And you touched on obviously regenerative medicine, the anti-aging medicine, and then also psychedelic medicine. Can you talk to us a little bit about how that came to be as part of an area that you began to study and then just put a professional foot forward to become versed in, to be knowledgeable?
Well, so this is so cool, and I'm going to start backwards a little bit, but it has been shown, they've done studies on ayahuasca, which is not something that's legal in the United States, but the studies on it actually show that it lengthens telomeres, which is a marker of aging. And so people who have done ayahuasca journeys over time actually are anti-aging, which is like mind-blowing to me. So it totally fits in the realm of what I do. And, my theory would be that, again, once you can deal with your mindset stuff, you can really, I mean, your mind impacts your body. And so for me, how I got into the psychedelic realm. Honestly, as a physician, I never thought like psychedelics would be part of my practice. I always was led to believe they're drugs and they're, people party and whatever. And then many years ago, I tried a psychedelic for the first time, and it changed my life. I thought, my husband was like, "You should go try it." This was a time in my life where my business was new. My husband was a stay-at-home dad. There was a lot of pressure on me. I was very stressed out. It was right before or after COVID hit. And he was like, what else is there for your stress levels, right? And so he was like, he had done it 6 months earlier. He's like, "You should go try it." And so I meditated on show me the way in my business. I didn't know what else. And I had no idea what to expect. I didn't know if it was literally going to be like, "You should post more on Instagram," right? I didn't really know, which sounds silly now that I know about these journeys, but I just needed something outside of what the world could give me at the time. So I did this psychedelic, which was 15 minutes long, and it changed my life. And it changed my life in the ways of, so I will tell you that now I'm going to try to describe the indescribable. But one of the most obvious way, and actually the less way for me that changed my life, is now that I do psychedelics in my practice. But the way that it changed my life was during this 15-minute journey. It was so beautiful and amazing and like out of this world. But there was a split second of like this thing that came to me that said, "There's no need to be afraid or anxious." Whatever. I wouldn't have even written. I wrote it off. The rest of the journey was just beautiful. And after I came back for 2 months, as close to literally as possible, I didn't feel my feet touch the ground. I didn't even know I had this fear or anxiety or whatever you want to call it that drives me until it was gone. I felt light as a feather. Nothing could bother me. Intellectually, I knew nothing had changed in my life, but emotionally, spiritually, energetically, I was a completely different person. I don't know how else to describe it. Even my husband would be like, "You are vibrating from across the room." Like, it was this energy around me. It was so different. So that was the life-changing part. They realized that 15 minutes of this one little medicine affected me for 2 months. For that stayed with me for 2 months. And it was amazing. And so that was the real life-changing part to me. And so realizing the power of these medicines that are natural, that come from Mother Earth, to really work with us. And they work with us. They're not these substances that you're taking to get out of your mind because you don't want to be here. It's not an escape. It is literally a healing medicine. And so that to me was the life changer. And then the medicine also told me, you have to help your patients in this way. And I struggled with that for a year. But that feeling of you have to help your patients in this manner didn't leave me. It was like the day I knew at 14 that I was going to be a doctor, and I never looked back. That's how strong that message was to me. And I fought with it because, going back to my very initial job that I had outside of residency, I worked with addicts. I worked with heroin addicts, ketamine addicts. I worked with people who abuse substances, and it was so unappealing to me. And what's legal in the US is ketamine as a psychedelic to work with as a physician. And I was just like, I can't do that. Why would I do that? But it wouldn't leave me. I literally fought with myself for an entire year until one day, I don't really remember the day, but I decided I was going to do it. And within that month of deciding, and I'd already been trained in doing ketamine because it's just part of my training in the pain management realm. Even though to administer it as a psychedelic, it's just different dosing and a very different kind of vibe. But the day I decided to do it, within that month, 3 different patients asked me if I do ketamine and can I help them in that realm. And so I said yes, and we moved forward. And it's been life-changing for my patients. I've had patients that are suicidal that are no longer suicidal. I've had patients that have been addicts to many substances for, 20, 30 years that are no longer addicts. And then just mainly patients who have some anxiety or depression and they don't want to continue taking meds, or they want to tolerate life a little bit better. And so I will say that, it adds to my practice in that realizing that mind-body connection. I've had patients who have gut health issues that do ketamine journeys with me that realize the trauma they had growing up is what's affecting their gut health, and therefore they can start eating food again. I'm trying to simplify it, but it's been so transformational for people because our minds and our bodies are not connected. They're connected.
Yeah, and I love how you dive deep into it because it's a very complex issue,
Yes.
and the you know I see how, and we've all seen it, just the mind body discord is prevalent in society. For you, in personally going through this, can you describe characteristically the reconnection of mind body and perhaps the what's missing in society that so many of us just have not had that connection yet?
Yeah, I mean, I think that we like to say, well, I think a lot of people can connect to their pain, right? I mean, so many people have pain and will notice, hopefully, that when they're more stressed out or where they're super busy or whatever, their pain is worse. Or maybe they have pain and they notice like a weather storm coming through and they'll say, well, when it rains, my knees hurt more. So I think that's a very easy connection for people to see. But I think most of our pain or our discomfort or our disease, we don't make that connection with. We assume that we have a dysfunction or a physical diagnosis or an ailment or a title that we attach to. And we don't ever make the connection of what's going on either presently or in the past with our mental health. And, it's hard to do. I'm not saying it's easy. And in our medical society, we don't generally honor that. We get these diagnoses of anxiety or depression or ADHD or whatever, and we assume that they are us, as opposed to assuming that they are something that happened to us that we can overcome. And so, even for me and my experience when it was like there's no need to be afraid or anxious, and that feeling of just, honestly, for the first time in my life, like, I think like deep peace that like it was going to be okay. Like, my business was going to be okay, or my family was going to be okay, or, and I don't know that I've honestly put words on it until now, but it was just in me, like in every cell of my body. And like, so I was just as productive at work without having to have like the monkey mind and the like feeling of chaos that I have to get everything done, but I was still doing the same things. But that complete change and the feeling inside of me was so powerful and comforting and necessary. And it's so interesting.
And I can imagine that making the decision for like when you went through it, but then also as you have worked with patients for to go through psychedelic medicine, that it's a very complex procedure. That it's a very carefully. It's not a fly by the seat of the a decision that's made, off the cuff, but it's something that's very carefully planned.
Definitely. I mean, A, it takes time. B, there are always medication interactions that you have to be careful of. And, my goal for people, it doesn't matter what my goal is for my patients, they have to want it for themselves. But my goal is always healing and health and feeling better physically and mentally. But if someone doesn't want it for myself, or if someone comes to me so ketamine can fix them, there's a conversation around that. Like, the medicine isn't going to fix you. You're going to fix yourself and you're going to do the work, but the medicine can maybe rocket ship you there or help you on the path to get there, right? And so, like, you can climb a mountain without trails, or you can climb a mountain with trails. And maybe ketamine is the trail, but you still have to do the climbing if you want to get to the top, right? And that's the same in your health, right? So you will do these journeys with me, and it's not necessarily about what happens during the journey. I mean, what happens during the journey can be amazingly transformative and powerful, and people can get messages and people can get feelings and sensations. But it's really about the work that's done after, right? I mean, I could have gotten the message of there's no need to be afraid or anxious and been like, cool, write that off, back to my life. But I mean, for me, it was so like energetically powerful, I couldn't ignore it. But I've done other journeys since then where I get messages that I journal. I'm not even a journaler, but I literally journal on it and I sit with it every morning for a couple of weeks after. And like, what does that mean to me or not? Or how can I interpret it or not? And sometimes there's interpretation and sometimes there isn't. And I try not to put too much into it, because I try not to let my mind take over like my heart, which sounds silly, but like there is an intuition and an inner knowing in all of us that is squashed as we get older as adults. And so if we can slow down and like listen to our inner knowing, that's kind of where the beauty of these medicines lie. And so circling back to what you said before or asked before, so much of these medicines really help people see themselves outside of themselves and look down on either their experiences or their emotions or their feelings, and I truly think it's root cause medicine, right? In functional medicine, we're like, functional medicine is root cause medicine, but this is like really evaluating yourself, and you can see where disease comes from. And so much disease does come from your limiting beliefs or mental health or your thoughts or whatever. And so, there is a lot of work and actual studies being done now on just like, not just, but meditation and how it's affecting disease. And this is, again, like a rocket ship to meditation. And it's not the end all be all for everything, but it's really powerful.
I agree. Extremely powerful. We're going to continue on. First, we're going to take a break. Stay right there. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Introducing Launchpad, the perfect partner to help you launch your dream project to the world. We know that time is of the essence, and we're here to help you make the most of it. With Launchpad, you'll get access to the most advanced digital tools and strategies to take your idea from a mere concept to a fully fledged success. Whether you're an aspiring entrepreneur or a seasoned pro, we have everything you need to make your mark in the world. Launchpad, your ultimate launch partner.
We can take our own health into our own hands. Okay, so we'll kind of expand on that. So I take a lot of vitamins every day. Long before I started this business, my wife has had me taking my vitamin C, my B complexes, amino acids every single solitary day, and I still do, even though I still do IVs as well. But when you take vitamins orally, you get 15 to 20% of them. Some people get less because they have autoimmune issues. Some people have a lot of inflammation issues, whatever the case may be, so they don't get the absorption that they need to be getting. So they don't get their immune system built up. Doing the mobile IVs, I'm able to take your immune system, I'm able to naturally boost it.
Welcome back to the Health Revolution. We are spending quality time with Dr. Jordana Quinn. She is a physician in regenerative, anti-aging, and psychedelic medicine. And before the break, we were talking about just the limiting beliefs and mindset that sometimes that obviously when the mind-body connection is intact, that now we're thinking beyond some of the beliefs that we've had. Now I beg to ask this question: does Western medicine have limiting beliefs about what the body can do, or how the patient can approach things?
I think Western medicine for sure has limiting beliefs. I think in our training, we are innately taught we don't get a lot of nutrition training. We don't get a lot of, like exercise training. We don't spend a lot of time in medicine learning about healing ourselves naturally. And like I said in the beginning, I think we come out of medical school residency thinking we know everything about health, when the truth is we know very little, I think, about health and how to stay healthy as individuals. We know how to treat disease as physicians, for sure. And we know how to save. I think our acute medical care is amazing. We could save lives, period. Our chronic medical disease care is terrible. We don't understand chronic disease and where it comes from. We don't understand true health and healing. And so I think that is a big part of it, unfortunately.
I love how you phrase it. I never heard that way before. The acute versus the chronic. That acute, addressing it right off the bat. That's something that things have been more innovative. But then the chronic issues, the getting below the surface is a totally different situation. And I can see how time consuming that functional medicine, holistic health approach, how that is. And I'm curious, how do you integrate spiritual health with your approach to patients? Can you share a little bit of that? What does that look like?
Yeah, so with 100% of my patients, so I do a couple of different things, but 100% of my patients, whether you come in for knee pain or you come in because you're a perimenopausal woman or, because you're a 60-year-old with chronic disease, I'm asking you all of the questions that I find important, from diet, exercise, but also your stress levels. How do you manage stress? What do you perceive your stress levels to be? I'm asking about if you have high quality or any relationships in your life, from your kids to your parents to your siblings to your just social network, because that is so important in our mental health. I'm asking you if you feel safe at home. I'm asking you about your mood generally. So you're like, why are you asking me all these questions? I'm coming in for knee pain. But it all affects our perception of our pain and our actual inflammation and pain in our knee. And so I get a very detailed history no matter who you are. So that helps me kind of determine, because not 100% of patients are doing psychedelics in my office. But something where we do stand out and unique is when people want to do something like, let's say, stem cells. We can use psychedelics to augment that procedure. So we will do a month or 6 weeks of intention setting, having you sit on your own. I mean, I can't go to your house and make you do it, but try to see those cells heal themselves in your knee. So if you have a meniscus tear, you have severe arthritis, you're spending 5 minutes a day just watching those cells heal your knee. So then we go and we do a procedure where we're actually putting cells in that are going to help heal your knee. And then we do this over the course of a week, do a few psychedelic journeys where you are, again, you kind of rocket shipping that like healing ability and really seeing yourself outside of yourself, and those cells heal your knee. And again, not everybody does that entire thing. A lot of people do. And, when you can do it all, it just takes your healing to the next level. But even if before you do a stem cell procedure, and that's all you're going to do with us, if you spend a month focusing on what you're putting in your mouth and what you're consuming on social media and what you're consuming otherwise, and watching those cells heal itself, you're going to have a better outcome.
What are some characteristics that a person presents when they come to you or you come across them and it sounds as though they're seeking the services that you have, but what are certain characteristics that tell you that that person is ready for that next step?
Again, in that detailed medical history, a lot of people want to give me just like, oh, this is what's going on with me. All of those questions that I ask are so important. 50% of it is the answer you give, but 50% is just getting this global understanding of the patient at a deeper level, partially of how they view themselves in the world and their disease or their ailment, and partially of like what's coming in, in their sphere in general. So it's that history. Spending time with the patient is so important. We can do it telemed or over the phone, but we can't just do it via email. And it's never just my back hurts. What do you think the best thing is? It's so much of a bigger conversation than that. And so, I just think because of the very detailed and the way I listen, I don't listen anymore with just how I was trained in medical school. It's not just the words you come out of my mouth. It's so much greater than what you're telling me. I don't know. It's just, I have this, I get a vibe. It's simultaneously your medical history, what you're presenting with, how you're saying the words, what you're saying, and the whole picture.
So maybe like the clarity that someone is really clear that they have at least as much of an understanding of where they are and intentionality of how they envision their healing or getting over where they're stuck, would you say?
Yeah, and partially what they don't, right? I've had patients, for example, say they're depressed, they want ketamine. And then we do ask all those questions, and it's like, they're not getting along with their spouse at all, and they're trying to work through this, but they're like, it's fine, I'm dealing with that. And it's like, no, that's actually part of your picture right now. Or maybe they have, again, like knee pain, but then we're talking about how they're going through divorce, and that contributes. It's not the end all be all. On your MRI, we might see that you have meniscus tear and arthritis, and for sure those are real biomechanical issues there, and those are real injuries. And also your divorce is affecting the inflammation in your body and the pain, or even how you perceive the pain. And so by asking all those questions, sometimes you can put 2 or 3 things together that are impacting their health as a whole to be able to treat them. So sometimes it's because we have a tendency to be like, oh, but I can handle this. Oh yeah, I don't have any more stress than I used to. And it's like, but that doesn't mean your physiology is still responding to the stress. So just because up here you think that, again, it's that mind-body connection. Up here you think you can just handle it, but your body is freaking out on you and you're not making that connection.
That's huge. That's huge.
Yeah.
We're going to take a quick commercial break. Stay right there. Don't go anywhere. We will be right back after this. Welcome back to the Health Revolution. Welcome back, everybody. We've been spending quality time with Dr. Jordana Quinn. She is a physician in regenerative, anti-aging, and psychedelic medicine, and definitely want to hold space for where we can all find you in the virtual space. Where are you out there in the virtual space, Dr. Quinn?
So all of my handles in the virtual space, like it says on over here in my thing, are Core Medicine. So Core with a K. You can find me on Instagram, Facebook, LinkedIn. And we didn't talk about this, and that's okay, but I also host retreats in California and Colorado. And those retreats are activevoyageretreat.com or on Instagram, Active Voyage Retreat. So you can find me virtually and you can find me online. I do in-person visits in Colorado or telemedicine visits anywhere. So happy to help.
A little bit. So the retreats, obviously, they're just they're a different avenue in which you're holding space. So I know you just had a retreat, but there are upcoming retreats. Can you talk a little bit about the expectation of them?
Yeah, I love the retreat setting because I get to spend 4 days with you. So it's generally, for example, if it's over a weekend, Thursday night through Sunday morning, and it's what I call a full wellness retreat. So I have found, either you go to like a yoga wellness retreat or it's focused on food, or you can do a psychedelic medicine retreat. But being an athlete and wanting to work on my mental health, I want it all. So these retreats really focus on, typically, it changes a little bit, but doing something like we have a chef that's cooking organic meals, and then we do something like a HIIT workout and then yoga and a meditation into like the psychedelic journey. We download in the evening. Sometimes we do some IV vitamins. So I really try to encompass or bring together the physical and the mental component, and spending days with people. And it's creating community, which is an important part of anti-aging and longevity, is actually having a sense of community. So my retreats try to just encompass in a short amount of time everything I believe in.
And so just to be clear, depending upon when the viewer sees this, you have them on an ongoing basis. And so then they are,
yes.
So there's something that they continue to be available different times of the year. Is that correct?
Yes, I have them about quarterly. Since we literally just had one, we don't have the next one scheduled. But typically it will be in the fall sometime.
And then on your website, I'm going to see if we can pull up your main website. Talk a little bit, talk for a few seconds about what viewers can expect if they are interested in your services, the type of different components that you have.
In terms of how to get a hold of me, or?
Yeah, so like obviously Core Medicine and some components about that.
Yeah, so you could find me online and you can make an inquiry on the website, or you can call. Our numbers on the website. Either way, you would get scheduled with an initial visit with either myself or the physician assistant. We practice the same. That visit is anywhere from 60 to 90 minutes, depending on what your condition is. If we need your labs or imaging, if you have them, we like to review it. And then we just go into a detailed, history and find out what's ailing you and how we can help. And then if you don't have the things we need, we order them and have the kind of follow-up visit, which is included in that initial visit if we didn't have all the information, and come up with a treatment plan. And the treatment plan is generally 6 to 12 months, ongoing, like you said, or whatever you need. We've had people will fly out here to do like a week-long kind of like what we talked about, stem cell psychedelic journey. It's kind of all over the board, but we truly just want you to find healing within yourself. We want to help you help yourself. That is our.
And then, in addition to that, I know that you are, in terms of representing the space and just being a voice in
Yes.
in the regenerative, the anti-aging, and the psychedelic medicine space. This is something that you speak about. That can we expect to see you in different speaking engagements and such?
Yeah, you should. I did do a lot of speaking engagements, and I've been on a lull just because life and family and all of that. But I'm passionate about it. I think people need to hear this message. I don't have an upcoming speaking engagement on the books, but I think this is important information to get out there. Just the knowledge, right, that we can help ourselves.
And then clearly you're available to speak in
Yes,
of this. Absolutely. So
I am available. People will reach out to me. It's easier when people reach out to me and ask me to speak than me searching for speaking engagements.
absolutely. Well, we are running out of time. Dr. Jordana Quinn, thank you so much for your time, your energy, and this is a very fascinating and a much needed topic to talk about. Thank you for spending time with us.
Yeah, thank you. Thank you for taking the time with me. This has been really, really great and fast.
Yes. So for all our viewers, of course, you can find us on the web. Our website is thehealthrevolutiontv.com. You can subscribe to our newsletter. You can certainly email us for any show episode ideas that you have. And upper left-hand corner of your screen, you will find our QR code. If that's easier for you to grab, please feel free to do so. And then, of course, every single Tuesday and Thursday, you can find us on E360 TV on the Achieve TV channel, 10 a.m. Pacific, 1 p.m. Eastern. That is all the time that we have. Until next time, take care of yourselves. We will see you soon.